呢啲咧都喺社區同埋咧家居接觸感染。我哋亦都大概咧有20名嘅職員咧會被列為密切接觸者。我哋咧亦都有大概10多名嘅病人咧喺入院篩查嗰陣時咧，發覺係初步確診。咁大概咧有50多名嘅同病房病人咧會列為密切接觸者。咁同時而家準備緊啲資料，咁稍後會喺新聞稿度公佈。唔該晒。
以下落嚟係答問環節，咁請大家喺發問之前呢講出你係屬於邊一個傳媒機構。右手邊最後排嗰位男士。
你好啊，有線人都想問翻，係咪真係打算落實嗰個叫做強制全民檢測，同埋要全香港禁足啦？係咪都係要深圳派人落嚟做化驗啊，甚至落嚟採樣嘅咧？仲有就係內地專家團，其實即係具體落嚟係做啲咩、睇啲咩嘅咧？會唔會都係內地方面都會派出一個流動檢測車落嚟，會點樣運作啦？同埋支援邊啲地方咧？咁另外都頭先HA 都講過話，好多急症室門口都有好多人等緊啦。其實嚟緊天氣又凍又會落雨，其實即係醫管局諗到咩方法處理呢班病人嚟嘅咧？即係前線嘅醫護人手有冇方法去增加咧？另外指定診所方面，因為即係專屬的士聽日先會啟用啦。今日去完診所啲人咧，有啲人係搭巴士走嘅，會唔會有啲風險咧？有啲病人真係如果負擔唔到的士嘅話，又可以點樣做咧？唔該。
不如副局答先。
好，就關於檢測有關嘅問題咧，咁行政長官喺早前已經進一步安排咗喺多位局長去分項咁樣管理同內地對接跟進之後嘅具體工作。咁咧就每一位分咗呢啲工作嘅局長係會用佢轄下嘅部門同事投入相關工作啦，亦都會適時向外界發放信息，等大眾咧可以掌握呢個唔同措施嘅進度同埋成效嘅。咁關於另外一個問題就係呢個內地專家嚟香港，咁呢個咧就有關於即係行政長官早前公布咧，由食衞局局長陳肇始教授去負責流行病學專家工作小組之後嘅跟進工作。咁咧就會呢一啲嘅喺內地嘅流行病學專家咧就會聯同衛生署啦，同埋醫管局同埋本地專家對接，然後去協助香港進行一啲病理排查嘅工作。咁我哋正係為呢樣嘢咧就作出安排嘅。唔該。
何醫生。
係，我哋咧先頭提到咧，有啲病人咧都喺院外、戶外嘅地方等緊。咁我哋醫護人員都睇到病人嗰個情況。咁咧，我哋咧就都會一定咧就會看住呢啲病人，希望即係 make sure 足夠咧保暖啦。咁同埋咧，我哋會睇住佢嘅情況，如果真係有變化咧，我哋會即係照料翻佢哋。咁我哋都同其他部門咧即係傾緊，佢哋都諗緊其他方法幫我哋啦。其中咧一啲咧就係睇下有冇一啲臨時室內嘅地方可以俾病人咧就喺度等候。咁至於人手方面啦，我哋先頭都提過，除咗我哋有一啲即係 part time 啊，或者咧都希望咧而家私人營業嘅即係喺嘅醫護人員咧，其實可以加埋參加我哋嗰個團隊啦。咁其實我哋都優化咗我哋嗰個登記嗰個情況。如果佢哋朝頭早登記咧，亦都可以下晝咧，其實已經可以參加到幫助我哋照顧病人嘅團隊㗎啦。咁至於你講嗰個指定診所咧，其實當然我哋都係即係希望留意即係病人留意返係點對點嘅即係交通安排啦嚇。唔該。
好，下一個提問，左手邊最後排第2位。
Good afternoon from the SCMP. My first 2 questions are for Dr. Choi, my last one for Dr. Ho. So the chief executive previously said that targeted testing by restriction testing declaration, or so-called lockdowns, and compulsory testing notices is better, and the Center for Health Protection's own figures support that. So would universal testing, especially coming only in March, be too late and a waste of resources to curb the 5th wave? And can we get an update on talks between the hospital authority and FHB on whether it is necessary for each positive patient to be admitted to hospital or isolated before being officially confirmed as recovered or discharged? And for Dr. Ho, yesterday you said it was, and I quote, far from satisfactory for patients, particularly the elderly, to have to wait outside hospitals for treatment. What has been done to change these conditions given that it's cold and raining today? And can the hospital authority also provide figures on patients in serious condition? So how many are there, the age range, and the vaccination status? Thanks.
About the testing strategy in Hong Kong so far, I think as our Chief Executive explained before, we have tried many attempts in restricted and testing exercises, and it has shown good result in picking up positive cases in an early stage. So whether the scale or the scope will be modified to suit the situation that is upcoming, I think we will announce in due course. And also, our Chief Executive announced, or she has assigned head of bureaus to take up various agenda or task force after the meeting with the mainland authorities last week. So that will also be in progress, and we will announce all the details in due course. About the admission based on the test and also the modification in the discharge criteria, we are trying to make the best use of our available facilities based on expert opinions and also the degree of control that we are going to offer right now. And of course, in the fifth wave so far, there are already more than 10,000 positive cases, and also with the experience of hospital authority in managing over 30,000 cases since the epidemic, they have observed that a large proportion of young, fit, or asymptomatic patients, they only need observation but no definitive or very sophisticated medical treatment. So based on the observation and also the experts' view, it's safe to observe them at home while pending admission. Of course, on the other hand, we are trying our best to increase the capacity for admitting them when these facilities are available, and we are working on that. Thank you.
Dr. Ho, please.
We have above 60-something serious cases on hand at the moment. And for the management of the demand of patients in A&E, we have adjusted criteria for patients admitted to the community isolation facilities. So for those without high-risk household, if they have a rapid test done on day 7 become negative, they can be released from the community isolation facilities to home. So, however, if those with a household with including elderly more than 70 years old, pregnant lady, those on hemodialysis or undergoing immunotherapy, they have to stay in the CIF till day 14. So we hope these adjustment in exit criteria can fasten the turnaround of the isolation bed, and so as to increase the capacity of our hospital to intake a more patient in need. And at the same time, we also want to have a promulgation to the RCHE manager so that in case the doctor, after the examination of the elderly, in case the doctor find them fit, please kindly reaccept the patients back to the RCHE. We will provide support to them with the CGAT team so as to help them to take care of the patients. And at the same time, we also mobilize some indoor areas such as the conference room, try to keep the patients stay inside the hospital instead of staying outdoor. With these multi-pronged measures, we hope to improve the situations. 60多個。
OK， 下一題問題，右手邊藍色第2行藍色衫嗰位。
你好啊 ，TVB 㗎，想問翻就係因為嚟緊都會有酒店陸續變成呢個社區隔離設施啦。咁頭先都有講到就係呢幾日天氣會轉涼啊，同埋落雨嗰啲啦，會唔會都考慮將喺公立醫院急症室外帳篷等緊嘅患者，即係首先去搬到呢啲酒店隔離設施先呢？定係即係酒店會有其他嘅用途啦？同埋就頭先提到有20個人離世啦，可唔可以講下係介乎幾歲，同埋會唔會 會涉及係因為醫院爆煲人手唔夠嘅失救情況咧？當中有冇一啲離世嘅人係喺帳篷等候緊嘅人呢？另外就想問翻呢，就係有即係多間媒體都引述就話有消息就全民檢測啦，就係會用一個非禁足式去做嘅。咁即係非禁足式個成效足唔足夠呢？點樣可以防止到嗰啲隱性患者會翻返去社區繼續傳播個病毒呢？會唔會都考慮即係分區做一啲全區嘅檢測或者配合圍封等等呢？另外都想追問翻就係內地專家組嚟講啦，可唔可以講多啲即係嚟到香港會有啲咩角色啊，同埋同即係港府啊、衛生署等等係點樣協調，同埋如果有分歧嘅話係會點樣達到佢共識咧？唔該。
係副局先。
或者我答後邊嗰兩條問題先啦。咁關於呢個檢測嗰個嘅做法咧，咁就當然政府一路都喺本港都實施咗唔同嘅檢測政策啦。咁關於喺呢個即係我哋同內地喺一個疫情嘅會議之後分享個會議之後咧，咁翻到嚟香港，其實特區政府同埋呢個行政長官已經即係分派咗唔同嘅局長處理有5個特別嘅專項嘅一個小組啦。咁其中一個咧就係都係同檢測有關。咁當然喺呢5個嘅小組下邊咧，每一個局長都會按佢轄下嘅部門去推行呢啲相關嘅工作，亦都係咧會適時向外界發放消息，俾大眾可以掌握呢個防疫措施嘅進度同埋成效嘅。咁另外就係關於內地專家組嚟香港，其實係都同呢個流行病學專家嘅即係交流有關啦。咁佢哋係會即係去協助香港進行呢個病理排查同分析工作。咁細節咧，我哋暫時即係我呢家暫時就冇，但係我喺適時如果有多啲嘅資料，我哋可以即係睇下點樣同大家去交代一下嘅。唔該。
唔該，何醫生。
好，今日24位離世嘅病人嘅年齡係介乎36至98歲嘅病人啦，有14男，咁就係10女。咁較為年輕嗰位病人呢，其實係一位長期病患嘅病人，咁都係需要長期照顧嘅。
好，下一個提問，左手邊呢位。
Thank you. I'm from Bloomberg News. I would like to ask about now that we have been 1 week into the tougher social distancing restrictions, including banning gatherings of more than 2 households. Does the government have any data on whether this has been effective in reducing the social activity of Hong Kongers? Given that the case numbers are still increasing exponentially. And my other question is about the mainland China experts. The director of the new National Bureau of Disease Control and Prevention, Wang Hesheng, was reported to have arrived in Shenzhen today, and he is helping to coordinate the effort to assist Hong Kong in the fight against the outbreak. Does the Hong Kong government have any plans to work with this new bureau to establish a stronger coordination? Because the bureau's mandate, which was published yesterday, said that they are setting up a Hong Kong, Macau, and Taiwan office specifically to work on pandemic preparedness with these regions. Thank you.
For any particular social distancing measure that we have implemented, it's not easy to single out any particular measure effect in the control of epidemic because everything add together. For example, limitation of gathering, people allowed to be gathered in either public area or also in cross-household gathering, and also closure of many facilities. And also work from home, for example. So it's difficult to isolate which factor is contributing to what effect. But of course, we will try to close monitor the epidemic situation. And by now, the situation is still worsening. As you know, the reported positive cases yesterday is significantly higher than that yesterday. And for our exchange with the mainland relevant parties, we are starting the communication work and also liaison after the meeting in Shenzhen with the mainland authorities. So in due course, when there's any progress, we will inform the public. Thank you.
好，下一個題問。右手邊綠色衫嗰位，第二行。
你好啊 Now TV 嘅。第一咧，想問下局長，可唔可以明確咁樣講到底，即係會唔會做全民檢測咧？係咪即係呢一項工作分咗去另一個局長去負責，就變咗即係少少詳情都唔可以透露到咧？同埋即係未進行全民檢測，而家嗰個醫療設施都已經咁緊張嘅話，即係多咗人檢測，理論上嗰個確診數字就會上升，即係一定會多咗噶嘛。即係到期時又點樣可以應對到更加多嘅確診呢？另外第二就係想問下就係即係局方有冇見到即係近日啲老人家喺醫院外面等嗰個情況，即係可唔可以 comment 一下呢？咁其實點解會導致到有呢一個問題出現呢？即係局方之前就話優先送嗰啲高風險，例如係小朋友或者長者先去醫院咁樣。咁但係去到結果又唔夠維修，變咗去出面等，會唔會認同其實而家呢個情況變咗唔送院仲好過送院呢？即係連一個室內等嘅地方都冇。另外咧就係想問翻HA 嗰方面，頭先就做咗個呼籲，就係關於安老院舍嗰邊，即係同佢哋講過希望佢哋即係收翻一啲其實情況 OK 嘅老人家翻去院舍，但係拒絕。想問下呢個情況可唔可以講多少少？係咪好多院舍都咁樣做？有冇統計到因為咁樣而留咗喺醫院嘅老人家數目大概有幾多呢？佢哋會唔會因為咁樣留咗喺嗰個室外地方而個情況反而變差咗、惡化咗？有冇啲 details 可以講下？唔該。
好，咁關於呢個檢測嘅策略咧，其實特區政府喺過往呢個疫情發展咁耐，都試過唔同嘅措施啦。咁特首都最近都去成日分享一啲喺過去做咗好多嘅一啲，譬如話限制要檢測嘅一啲措施啦，咁都係有好大嘅成效，因為聚焦咁樣喺一啲高風險嘅地區做一啲測試。咁但下一步會點樣推展唔同檢測嘅方案呢？咁相信即係政府係會喺適時去公佈俾市民得知嘅。咁關於嗰個醫療系統個負荷咧，即係我想講，其實我哋係多方面去即係處理個問題。咁第一就係容量個樽頸嘅問題，呢個我哋係非常清楚，因為頭先或者喺記者會嘅時候，醫管局其實都有講佢哋嘅容量已經去到幾多個百分比啊。咁同埋就係都見到即係需要等候入呢個醫院或者係一啲社區隔離措施嘅人係，我哋知道係有呢個嘅問題。咁所以呢一方面咧，就特首都已經宣布咗，我哋係會揾一啲公共屋邨啦。嗰個好處係因為即時有一個硬件，我哋係需要做一啲配套就可以容納到。另外就揾一啲酒店啦，咁呢個都係積極進行當中，同埋反應都係正面嘅。咁第三就係一個源頭嗰度啦，即係如果係可以更新一啲出院嘅指引，即係離開個隔離設施嘅指引。當然個前提就係佢能夠符合一啲防疫抗疫嗰個或者傳染嗰個嘅一啲標準啦，以至佢哋翻去咧都唔會帶嚟啲風險。喺呢個大前提底下咧，就增加嗰個設施嘅流轉，咁呢個都幫到處理大量嘅病人嘅。唔該。
要啲長者咧喺戶外等咧，呢個情況咧，即係梗係唔理想啦。我哋冇做一個詳細嘅統計，不過即係我哋都希望佢哋盡量配合幫助接收翻一啲，即係我哋已經睇過啦，病情穩定嘅長者入翻去院舍啦。
好，下一個提問。左手邊第二行藍色衫嗰位。
你好，明報嘅。首先想問一問食衞局啦，預期而家即係最新呢一個即係 安排，即係將可以喺嗰個逗留隔離設施或者係留院日數係預期病人 average 可以由幾多日減到幾多日咧？啲病人佢哋喺屋企係你哋預計佢哋可以點樣檢測咧？係用嗰個深喉唾液啊，定係點樣咧？因為而家嗰個社區嗰個缺樽嗰個情況都好嚴重咁，你哋係會安排啲樽俾佢哋，定係佢哋都要請家人朋友幫佢哋拎咧？如果佢哋驗到陽性7日之後都未入到嗰個隔離設施嘅話，但係佢已經陰性咗啦，咁佢仲使唔使入去？定係其實佢已經可以繼續再 stay 翻喺屋企咧？同埋都想問埋會唔會即係考慮家居治療咧？因為都有啲專家都建議參考呢個新加坡，即係確診者自己喺屋企快速測試驗到陰性之後，或者喺屋企留7日，無論係咪陰性，即係都可以出社區。就想問翻即係局方會唔會考慮啦？第二就係想問翻呢個醫管局嘅，就想問下而家指定診所處理咗幾多個病人啦？佢哋個病情係點樣樣？有冇講話即係最嚴重嘅嗰個情況大概係點樣樣？有冇一個數字係而家啲病人最長喺社區等咗幾多日都入唔到醫院？會唔會考慮下呢一個遙距診症？同埋想問翻有2100個病人而家喺竹篙灣啦，大概，但係竹篙灣嗰個容量應該有3500啦，見到未用盡，係咪都係因為唔夠人手去處理啲人去即係入嗰個竹篙灣呢？最後想問下而家HK 轄下嘅隔離設施嘅嗰個容量同埋使用率嘅嗰個 breakdown。同埋而家有冇統計過幾多個病人要喺一啲戶外地方等候？會唔會即係除咗瑪麗醫院會改裝活動室，俾啲病人入去之外，有冇其他醫院都會考慮做呢一樣嘢？同埋都有專家建議 CT 值未夠30嘅病人可以送去會展，會唔會考慮呢？唔該。
係，或者我答第一同第三條問題啦。第一個就係講關於如果推行咗頭先講嗰啲即係縮短呢個住喺隔離設施嘅日數嘅話，可以有啲乜嘢嘅效益啦？咁簡單嚟講，即係話起碼有部分嘅人可以7日之後就離開啦。咁然後就去到14日，如果係陰性嘅話咧，佢哋可以自由離開家居嘅。咁簡單回覆呢樣啦。咁第三個問題講緊呢個竹篙灣嘅人手，咁人手嗰度咧暫時係足夠嘅，因為主要負責譬如話流程啊、醫療嘅服務啊、其他支援嘅配套咧，依家都係 OK 嘅。唔該。
副局長有家居感染咗點樣做檢測？對佢哋嗰啲協助。
OK 嗱，檢測嘅方法同埋個方案或者細節咧，我哋用後會公佈。唔該。
何醫生唔該。
好。琴日咧，我哋嗰個 designated clinic 咧，指定診所都係睇咗700幾個病人啦。咁我哋都喺度儲緊啲經驗。其實佢哋大部分咧都係有啲輕微病徵。咁我哋咧同佢即係睇完俾咗啲藥咧，其實佢哋都即係繼續返屋企咁樣休息。咁至於嗰個遙距嗰個，我哋其實咧而家咧就有一個熱線，可以俾啲病人咧就打電話嚟查詢一啲資料，咁都係我哋係我哋有一啲護士同埋一啲專職醫療嘅同事咧，就幫手接聽嗰啲電話嘅。咁嚟緊咧，我哋都會咧考慮緊，如果佢哋有進一步嘅醫療嘅問題咧，其實我哋都諗緊咧，係咪可以有一啲即係我哋私營嘅同事咧，其實可以幫到我哋手，再踏進一步咧，即係一啲即係關於佢個病情更加進一步嘅問題。咁呢個我哋係考量當中嚇。
你可唔可以請你問多一次？
不如用翻個咪。
如果嗰個病人佢驗到陽性，佢之後7日都未入到隔離設施啦，但係佢第7日喺屋企自己驗到已經陰性，咁佢係咪仲使唔使入去？定係其實佢唔使入去，淨係喺屋企留7日，留多7日，留到第14日就可以走？
我希望冇聽錯你嘅問題啊！即係如果初係陽性，咁如果係講家居情況許可㗎啦嚇，咁佢如果喺測試陽性起計7日之後檢測為陰性，就可以由社區隔離設施返屋企，但係要逗留到14日再做陰性咧，先至可以自由離開嗰個嘅居所。咁就即係話，如果上代入院嘅人士等候14日檢測結果顯示係陰性嘅咧， 就同喺社區檢查喺社區隔離設施住過嘅人咧一樣咧，用14日做一個界線咧，就可以喺陰性之後就離開嗰個屋企啦。
好，下一個提問，左手邊第二行男士。
呢個 AM730 頭先提到嗰個陽性檢測咧，係咪等14日就冇風險就可以唔使入院？係咪即係代表係叫做實施緊一個即係變相係做呢個在家治療呢個政策咧？同埋如果冇病徵嗰啲，定還是即係有啲病人都好快可以出院，其實係咪即係都本身唔使等7日嗰個安排都依然適用嘅咧？同埋呢個更新係有冇話幾時開始生效嘅？另外就係公立醫院門口即係戶外近日都好多人喺分流站嗰度等，其實有冇收到啲個案就係已經出現咗低溫症或者甚至乎係死亡嘅情況咧？即係喺等候入院期間，頭先HA 提到話有啲部門會商討借出室內咧，想知呢啲係咩部門啦，同埋有關場地係即係喺醫院入邊嗰啲，定還是喺啲社區嚟體育館等等咧？最後就係想了解個危殆個案 age range 有冇咧？唔該。
好，簡單回應咧，就呢一個措施咧並不是一個家居治療嘅一個方案，只係咧為一啲仍然等候緊入院嘅人士嘅一啲安排。咁就關於幾時生效啊？何醫生可唔可以講啊？補充生效有冇生效日子啊？
我諗關於先頭即係話由社區隔離設施嗰個出院嗰個安排咧，就係今日而家即時生效㗎啦。咁至於你先頭講嗰個危殆嗰個病人嗰個 age range 咧，或者有冇其他問題問先？我轉頭俾你。好。而家咧病人嘅情況咧，就我哋一路都有睇住，咁即係亦都慶幸暫時未有咁嘅情況。
好，我哋下一個提問，右手邊第二行啡色衫嗰位。
你好，大公報嘅，想問下醫管局而家每日都有超過100名醫護人員係確診或者初步確診啦，醫管局方面應該點樣解決呢個醫護人手不足嘅問題？第二想問下啲酒店將改成隔離病房，每日喺收費係幾錢呢？如果病人要自己俾錢，要付幾多錢？如果病人嘅情況真係貧窮冇呢個能力去支付呢個費用，醫管局方面同埋政府應該點樣處理呢種情況？唔該。
唔好意思啊，先頭人手嗰方面咧，其實對於即係有一啲我哋同事確診或者初步確診或者隔離咧，對於我哋人手個壓力咧都係好大。咁所以咧，即係其實我哋都有調整咗我哋一啲預約手術嘅服務。其實嚟緊咧，我哋係會即係減低到至到即係之前我哋係減低到50%啦。其實我哋會再調整到即係降低到去40%到左右嘅服務。咁呢度咧，一方面咧就希望調度到啲人手啦，即係去集中處理疫情啦。同時間咧，我哋亦都有一啲咧特別嘅即係加班津貼，希望咧有啲同事咧可以即係加班幫我哋咧即係一齊繼續即係增長服務嘅時間啦。咁另外咧，我哋都有即係邀請一啲 part time 咁同埋咧即係 local office， 希望咧私營嘅同事咧就會再加入我哋個團隊一齊服務。咁喺呢度咧，我哋特別咧都睇下即係私營嘅機構啦，可唔可以咧都分擔一啲社區隔離設施醫療站嘅管理同埋運作？咁呢個咧都可以幫到我哋咧調動翻啲人手咧去翻醫院前線嗰度抗疫咁啊。
關於呢個隔離嘅需要咧，即係無論佢係喺咩地方進行隔離，基於一啲公共衛生嘅考慮同埋個法例嘅要求咧，呢啲人士都係唔需要自己俾錢嘅。唔該。
好，下一個提問，左手邊最後排長頭髮嗰深色衫嗰位。
Good afternoon. Some questions from RTHK. So some infected people with no and mild symptoms can go out after 14 days of self-isolation at home if they test negative. So is this a general guideline or is this a mandatory rule? And what are the infection risks? And as mentioned just now, some elderly care homes refuse to take back the elderly patients from public hospitals. So how many such cases are there, and did they explain why they refuse to do so? And as there are 7 public hospitals reaching or even exceeding their full capacity, so does the HA have any concrete measures to alleviate the burden? And the last question, as Dr. Choi said, the 5th wave infections have surpassed the total number of cases in the past 2 years. So is there a need to do mass testing in Hong Kong to control the pandemic? And can you assess the possibility of doing so? Thank you.
Well, thank you for your questions. For the first question, referring to the new measures in discharge a patient from the community isolation facility is based on, of course, the characteristics of the Omicron virus, and also the experts' views, the relevant experts' view on whether it's safe from the infectious disease control perspective to release the individual from these facilities based on test result. So based on this, and also the need to improve the turnover, to increase the turnover of these facilities, we adopt this new measure. So this is a practical and also valid approach to address the infection control perspective, and also the need to have more facilities to accommodate people who need isolation. And for the last question about testing strategy, I think we have adopted different testing measures and strategies in the past. And of course, with the epidemic situation, we will constantly review the testing strategy and will announce any measures in due course to the public. Thank you.
For the age range of the critical diseases is range from 12-month-olds to age 94 years old.
Maybe I can repeat my questions for the HA. So some elderly care homes refuse to take back the elderly patients from public hospitals. And so how many such cases are there? And did they explain why they refuse to do so? And also, like 7 public hospitals have reached or even exceeded their full capacity. So does the HA have any concrete measures to alleviate these burdens? Thank you.
I do not have the concrete number of the elderly home that refuse acceptance of the stable residents. In fact, I think it's a very difficult situation for the whole society. I think some of their staff and also they may have other worries. So that's why we will also send the outreach team to support them in case they have any worry. And for the hospital, we have reached over 90% of our isolation capacity. So that's why we are going to explore more community isolation facilities together with the government. And we will prepare and mobilize the manpower to support that community service.
好，下一個提問，右手邊最尾嗰行啡色衫嗰位。
你好，你好，經濟日報嘅。首先想問下徐副局啦，即係頭先都有行家追問過，就係即係全民檢測個可行性，其實當局有冇去評估過？即係如果真係咁足嘅話，可以點？